the world witnessed Seveso, Bhopal, Chernobyl, 1986, and actually in the same year, ultimately, in Basel, Schweizerhalle, the disaster. I was on night shift in the women's hospital, my wife and first daughter Tilla at home when the alarms began. It changed the mindset of many people and the careers, and that's also true for me. In 1987, we celebrated the launching of the EFU, the Ärzte für Umweltschutz, the Physicians for the Environment, and they are still running. And air pollution was at that time the prime focus, with a strong call for clean air. And here comes already my second big luck. The Swiss politicians, they called for the research in environment and health. The National Research Program 26 was born from the Swiss National Science Foundation. And actually, SNF became my longest term, very, very important support indeed with a fellowship and projects. So when I considered and decided to try to move into research in environmental health, again, I was extremely lucky. I crossed the road of these essential companion supervisors, advisors, colleagues, coaches, and friends. They all had an instrumental role in shaping environmental health sciences in Switzerland and in changing my career 180 degrees. When I left the male-driven hospital environment, I learned from these 4 women from day one on about the strong power of women in science and the long way our society has to go to fully acknowledge this. One experience remains unforgettable for me. I was this young, naive assistant doctor for only 2 or 3 months. Ursula Ackermann, who I'm very pleased to see here in the room. Ursula, she was the first women full professor in the medical faculty in Basel. And she asked me to help her to carry some things to the auditorium where she had to take the final exams in public health. Arriving in the auditorium, the technician approached us. Well, the technician approached me, assuming that I'm the professor, and of course, Ursula was my secretary. I was really shocked, I have to tell you. I was ashamed. And yes, things have changed a bit since 1989. But please, I have a wish for today. Please continue to call for more women in leading position in academia in Switzerland. Change has still to come. Without Ursula and without Charlotte, Switzerland, Basel University would not have had a public health science institute dedicated to the environment. Ursula became the mother of the Swiss study on air pollution and lung and heart disease, Sapaldia, which became my other very big luck in my career. It was my most important training opportunity at the times we developed the methods, and I could work as the first coordinator. Charlotte, her children's study, Scarpol, together with Sapaldia, they became very early flagships of the really highly successful Swiss air pollution epidemiology agenda. Lee, Elisabeth Zemp, was at that time the key adjunct for Ursula to bring actually the National Research Program to a successful takeoff. And I was very impressed also about her, this very structured, well-thought way of working. And I have to tell you, it was such a difference from working in the hospital. And Nicole, she belonged, like me, to this very first group of enthusiasts who helped shaping this national 8-center study from day one. This was the time we were proud and not ashamed to have a fax machine. Nicole, you remember? Well, sorry to those from the Federal Office of Public Health. Through the last 20 years, Nicole scaled Ursula's legacy up with a very visionary brain. I have to tell you, she made Sapaldia the world-renowned and still only population-based Swiss national cohort and biobank focusing on healthy aging. It's still running since 33 years. And yes, my last question today indeed will go to you, Nicole. But my very first research project that I had again the luck to work on was actually Charlotte's very first SNF grant to investigate the health effects of ozone in children. Her successful grant writing again was my luck. I didn't contribute to that. And Charlotte, she entrusted me the role as a project assistant, although I had zero training in research in epidemiology. And I tell that actually to the many PhD students who are here. You cannot imagine that, but that's true. Because Switzerland at that time did not have these 8 million epidemiologists that we now have since the beginning of the pandemic. So I had to engage in learning by doing, and Charlotte, she was a brilliant coach. Actually, she greeted me. She's currently on a wonderful travel in Anatolia. We observed in the Ticino that ozone has acute effects on children, on their lung function. But what I did not anticipate, that ozone would challenge my luck once again. At the end of my master in public health in Berkeley in 1993, I looked for a supervisor for a PhD, and PhD students here, you know how difficult that is. So because my SNF fellowship got expanded, and I'm not joking, it was exactly in that month when these outstanding scientists from Harvard got appointed as a professor in epidemiology at UC Berkeley School of Public Health. And you know what? Neira was just about to win a brilliant grant from the prestigious Health Effects Institute to investigate the long-term effects of ozone in college students. Yes, ozone, it's true. That was my thing again and my luck. And I'm still very, very thankful that Neira gave me the opportunity to be his PhD students. My research path, I have to tell you, had never been the same without his very strong, very sharp supervision, advice, and support. And actually, he brought me also close to his network in the US. Me, again, a very lucky person. So what did we learn from 30 years of research? Well, before I tell you that, you should also know a historic note. In 1990, there were some 800 research papers on air pollution and health. Since many, many years, I regularly searched the Web of Science for air pollution and health. Now, many more than 100,000 authors published more than 60,000 publications. Prior to summarize those findings in the next 10 hours, let me share a note about these 100,000 scientists. I know it is very, very un-Swiss to be blunt about success. I thought that I break this rule today, the rule of humble understatement, and share with you what the Web of Science discloses if you go and look at it since many years. Under the top 100 most productive scientists, there are 3 who started to collaborate in Basel under the lead of Ursula. It's true, Nicole, Christian. I think Christian is online. It makes me very, very happy that we became this trio of a successful collaboration through all these years. And Nicole, I have to tell you, I'm not sure you know that, but this is not even enough. In the most recent years, the Web of Science tells us even more about your department that you have under great leadership, the Department of Epidemiology and Public Health at Swiss TPH. Swiss TPH now appears with even now 5 under the top 100. And Martin Rösli is very close to move into the top 100. Yeah, this is wonderful. Actually, what Web of Science also discloses is that I have 1,160 in this journey. First, air pollution affects people's health. We heard it already yesterday, ranging from mild physiologic changes to acute effects like heart attacks, like strokes, and to chronic diseases which ultimately reduce life expectancy. So chronic diseases like atherosclerosis, like diabetes and lung cancer and others. Those effects can be observed also at a very low level of concentration. And those multisystemic findings, they are not just statistical associations, but the result of a range of causal mechanisms of which several have been identified. Meanwhile, given in fact the enormous progress, not only in epidemiology, but also in experimental research. Nicole referred to this paper of our good colleague and friend Annette Peters, a wonderful paper if you are interested in the mechanisms, published in Cell last year. In fact, Swiss researchers also have a strong record in experimental science, not only in epidemiology, particularly, for example, the teams of Barbara Rothen at the University of Fribourg and Marianne Geiser. But let me go back to this graph. This is a LUDOC graph. It is on the website of Swiss TPH. It features the health effects of ambient air pollution, ranked even by evidence. So what is LUDOC? LUDOC is again a visionary project initiated by Ursula and her team more than 30 years ago. On behalf of the Federal Office of the Environment, LUDOC reviews and summarizes the scientific literature on air pollution and health to advise the federal offices, the counties, Circle Air, policymakers, and the public, and also the scientists. If you look back to March 2020, well, the pandemic, we all know that the link between science and the leading decision makers was completely unorganized, a chaotic, cacophonic disaster in the first weeks. Thus, everybody now calls for a better connection between science and policy, and of course, we all would fully agree on that. But let me be blunt, in the field of air pollution and health, Switzerland does exactly this since 35 years, very successfully with LUDOC. So who is behind LUDOC? Well, Regula Rapp, she became the grande dame of LUDOC over decades, knowledged like the web of science herself, and I'm very glad you're here, Regula, thank you very much. And then she handed it over after introducing Meltem, who is an excellent and highly successful LUDOC leader now since 2014. I tell you, if you send an email to LUDOC, she will make sure you get an answer in due time on everything about air pollution and health. So let me move to the second point. Although the individual risk of air pollution is rather small, much smaller than the risk related to smoking, the overall burden of disease and death attributable to ambient air pollution is very large. You see this number, the 7 million, or the 4 million related to ambient air pollution. And why is that? Well, it is simply because everybody is exposed to it through lifetime. So you may wonder how one derives these numbers, these 7 million of the burden. And let me once again look back. Swiss authorities, that's true, under the counselor of Adolf Ogi, they were the first governments to call the scientists. Indeed, his office called Ursula Ackermann in 1996. The government wanted to know what the health burden and the related costs would be of ambient air pollution in Switzerland. Yes, you heard yesterday Julia Steinberger in her excellent talk and statements, the missing piece of economists. These economists have contributed to that study already 20 years ago. So again, the luck was on my side. Ursula called me in Berkeley and offered me the lead of this fascinating project. We were able to establish the methodology and move the burden of disease for air pollution forward, first for Switzerland, then for Austria also, and for France. And ultimately, we assisted WHO to integrate air pollution in the global burden of disease, which is now the case, the default since about 20 years. It's rooted on the Swiss methodology. And these days it enables Dr. Tedros to communicate the global size of this problem, which is a huge one. So what is my third take-home message? Those effects cannot and should not be assigned to single pollutants. There is no silver bullet, please. Do not trust those lamppost scientists, I would call them. And I tell you, there are many. Every pollutant has a research lobby. Yes, and Richard, you are laughing, you know that. The coarse particle church considers the fine particle sect disbelievers. The ultrafine worshippers, they bash on the ozonists, whereas the European Nitrogen Dioxide Party, created by Ursula, gets ridiculed by the PM 2.5ers who dominate, in fact, the East Coast in the US. And under some lampposts, you find the oxidative potentialists distributing their flyers about oxidative stress being the holy grail of everything under the dirty skies. Whereas the secondary organists, they are currently themselves seen as the callers in the desert. Please don't trust the claims for silver bullets. Air pollution is and remains a complex mixture of hundreds of pollutants, mostly combustion related, which orchestrate a myriad of health outcomes via a range of mechanisms, even competing mechanisms. Why do I emphasize this? Don't lose your time under the lamppost. Use the available science to take action. And that's my fourth point. The solution to the problem does not consist in running behind a silver bullet. It is not about engineering particles that are less oxidative or to just remove one single toxic additive such as lead from gasoline. No, it is like with smoking, where the solution is not a cleaner cigarette, but of course not to start smoking. The solution for air pollution is sustainable, concerted, clean air policy making to stop polluting at the source. And clean air policy is also not about asking people to protect themselves. We as individuals are not the ultimate responsible for our health. So please, this community, and we had it yesterday on one discussion, stand up against this prevalent belief in Swiss politics. Health prevention, health promotion is not just a private personal issue. It is a public structural responsibility, and it is an opportunity. And that's why Switzerland needs a law on prevention. Else, as you all know, it is extremely difficult to take public health action. Well, and this brings me to my other very, very big luck. My work, our science does not depend on the law of prevention, which is still missing. I had the privilege to work in the field of health where the action is explicitly endorsed by a law already established in 1983, the Swiss environmental law. It requires explicitly that we keep our environment healthy to protect people, animals, and the ecosystem from adverse effects. And therefore, science-based action for clear skies is not just an option, but actually required by law. That raises a difficult question. How should we define healthy air? Well, the World Health Organization since 1987 provides extremely important scientific evidence, science-based guidance on how air quality should be to protect health. WHO has taken the lead in publishing these air quality guideline values, and the governments should use those science-based values to define legally binding limit values to protect people's health. The slide here shows you what WHO suggested in 2005 as a target for clean air policy. Let me focus only on the pollutants that are still relevant in Switzerland. And currently, let me just compare the limit values in Switzerland with the WHO guideline values of 2005. We will come back to the new ones later. As you see, current limit values are in line with these WHO guidelines. The deviations relate just to different statistical parameterization, but are in essence, from a health perspective, identical with WHO. The national limit values set the targets for clean air management plans. So the question is, does it work? Did it work in Switzerland? Well, this slide summarizes the success story of science-based air pollution policymaking. The trends in air quality, and what you see here in the example, these are 25 years of the fine particles, the PM2.5. It proves that environmental pollution is not the price to pay for economic prosperity. Or does anyone in the room believe that we had a 25 years of economic crisis in Switzerland? No. As you see, air quality in Switzerland is meanwhile compliant with the limit values almost everywhere, including hotspots. In the Alps, where I was born, at the time I was born, pollution was higher than it is today at the worst place in Switzerland. That's progress. So prior to open my talk to much less positive global realities, let me ask Dr. Richard Ballaman to come on stage. As I have a question for you, Richard looks back on a long and successful career at the front line of the section in charge of clean air at the Swiss Federal Office of the Environment. And Switzerland, Richard, has this outstanding record with major improvements in concentrations of most ambient air pollutants. What do you think is the recipe behind this incredible success story? Why was this ever possible? Please, Richard, take the microphone.
Thank you very much, Nino. First of all, thank you very much for your efforts during this long time. I think that's not only lucky events, that's a lot of work. And that is the first recipe, to work and to never give up, but work hard and hard. Thank you also to give me the opportunity to share with you and also people outside of Switzerland to share our experience from Switzerland by abating air pollution. In fact, we start quite early, that is really a point, so 40 years ago and even more. And I would say we had several key elements which are determining the improvement of air quality. And I will try now to summarize that in 5 points. And that's really the first one is crucial. You already mentioned that. It's that we need long-term objectives which are based on human health and ecosystem protection. And that has to be done at the higher level of the legislation. You mentioned the Environmental Protection Act, but that even in the basic, in the Confederation and the Constitution, Federal Constitution, we have, which is an Article 74, which specified the Confederation should legislate on the protection of the population and its natural environment against damage and nuisance. And that is a key element for then to motivate the government and also the policymakers in all departments, not only the Ministry of Health or the Ministry of Environment, but also the Ministry of Finance, the Ministry of Economy, Industry, Energy, Transport. Everybody has to work in favor of the well-being of the population and to avoid any nuisance and damage through air pollution, by the way. The second point is, based on this effects-oriented approach, we need to establish emission reduction targets for the key pollutants. You had the list before, Dino showed that is a dozen of key pollutants which have to be fixed with reference to a certain year so that we know where we start and where we go. And that is really the critical point to have a healthy air at the end, but we are starting from a certain point. And these emission reduction targets could be established at the national level, certainly, alone, but standalone is never so amusing. So it's probably better to work together. And then we have some, because the air pollution is by nature transboundary, so there is no border for air pollution. And we have a good example from the international agreement from the UNECE Air Convention, where 48 countries from Europe, from Central Asia to Atlantic, plus North America, US and Canada, were working together to try to establish new targets, emission reduction targets. And then, for sure, national efforts are crucial to move forwards, but together is probably more efficient. We currently establish a new forum for international cooperation on air pollution, and we hope also that other countries outside UNECE will join the efforts to improve the situation. So we have a lot of things to exchange. Then the third key is definitely to identify the sources of pollutants and to quantify them. So that is through a reliable emission inventory. It looks like a countability. Sometimes it's a little boring, but it is evidently a key element to see where are the pollutants coming from, what are the activities responsible for this emission. Then evidently we need to improve the air quality, and that is by applying implementation of best available techniques to all sectors, not only by burning activities, not only by combustion, but also by industrial activities, by agriculture, by the way, by transport, by energy production and use. The fifth key is definitely to monitor air quality, and that, as it is shown on this graph and was presented by Nino, we need to compare with some targets, some objective like the WHO air quality guidelines, in a way to improve the awareness of the public, but also to convince the policymakers on the needs to act. Here we see that, for example, the guide value from WHO established in 2005 are more or less achieved in Switzerland. So that is possible, that is achievable. It is a lot of efforts. It does not go in 1 year, but with efforts we can achieve that. So ladies and gentlemen, it was a pleasure to present you this experience, and thank you very much, Nino, for your efforts during so many years.
Well, Richard, the thank is on our side. I have to say, I was always very impressed. Collaboration with the Federal Office is fantastic. You have this attitude to be science-oriented. People like Martin Schiers, who is just retired as well, Lara Lüthi, Brigitte Gelli, Peter Strehl, who is with us, Beat Achermann, Hugo Amaker, Reto Meyer, and others. It is always really a very, very good way of collaborating with science. I thought, I don't want to stress you, Richard, with the new WHO air quality guideline. Yeah, so this is this red line, and in fact, not only for PM 2.5, but for all pollutants, WHO calls for even lower concentrations based on the most recent science. I can promise you, Richard, despite my retirement, I remain the president of the Swiss Commission of Air Hygiene for another year. We will propose to the Councillor Sommaruga what Switzerland should do in light of these new values. You realized Richard did not talk or feature any personal prevention policies, such as promoting masks or filter devices. And in fact, this was never on our own research agenda. But I have to say, highly polluted countries triggered such research many years ago already, some 10 years ago. There is research showing already prior to the pandemic that masks do indeed filter out rather effectively those nasty fine particles, which have just about the size of a coronavirus. This is a more recent study here showing how hospital admissions would decrease during a heavy smoke episode, depending on the type of masks that people would wear. So you see with very simple natural masks, the reduction is only 7%, whereas efficient masks could reduce hospital admissions by some 30%. Indeed, I have to tell you, the science, air pollution science community was rather puzzled in the early phase of the pandemic when some claimed that masks do not protect, or that masks would only protect the others, but not yourself. Science has shown years ago, and yes, if you have to visit Beijing or Ulaanbaatar or Lagos or New Delhi during a smog episode, a mask can reduce not only the number of viruses, but also the number of nasty toxic particles that you would otherwise inhale. That's simply physics. So masks reduce the risk, but of course, masks are not the solution for air pollution. So let me now talk more from a global perspective. There are less good news to share. The pandemic and now the war have shown us the face of globalization. We now see in our daily life how connected the economy actually is. And this article of Zhang, published in Nature, he has quantified the sobering environmental realities of the globalized economy. It is a very complex paper, a lot of maps and figures, but in a nutshell, the Western Europe, including Switzerland, are the world leaders in outsourcing air pollution to the global East and South to support our high standard of living in rather clean air, as we have seen. This means also we outsource air pollution related deaths, and that's what the paper shows and quantifies, or also morbidities, to Asia and the South. So that is kind of the other face of made in China. We sell our dirtiest trucks and outdated technologies to the South, to Africa. Swiss companies produce and sell the dirtiest possible diesel in many regions of Africa. They call it African diesel, African quality, yes, officially. The sulfur content in this diesel is up to 600 times higher than what it is allowed in Switzerland. And this causes extremely high, nasty pollution, soot, stinky air in African megacities, made out of Switzerland, you would say. So why is this possible? This is all legal. Well, it is possible because economy is globalized, but clean air regulations, emission standards, limit values, they are not globalized at all. And the consequences of this unregulated globalization of pollution are shown in this simplified graph. Air quality in the West is steadily improving, not only in Switzerland, all over, including Eastern Europe, but highly polluted regions in the global South and East, they suffer from the opposite trends. Air quality is still getting worse. And I think that's the moment that we should talk to the World Health Organization, WHO. So now I ask the technicians to open the Zoom, because a key representative is with us online, namely Dr. Maria Neira. Maria, I really hope you hear us. You are the director of the Department of Environment, Climate Change and Health at the World Health Organization. And you are the leading figure at WHO behind the WHO air quality guidelines. Indeed, clean air has been at the heart of your very long and very impressive career as a global leader in public health. As mentioned, Maria, the WHO air quality guidelines got revised, and you know that in 2021. It was my pleasure and honor to work, in fact, for the guideline development group for the last 5 years. And the newest scientific evidence has forced us to propose these much tougher guideline values. And you can be proud that those got published under your leadership. But Maria, let me share the reality of national limit values. And I know you know this table from our paper. It's sobering. Maria, we revealed that the governments do not care about WHO air quality guidelines. Only 60% of countries regulate at least one pollutant. And among those, many adopted limit values that do not protect public health at all. A very, very bad example is indeed the European Union with its particle limit standards in the regulation set to please a few industries instead of protecting public health. There are only 9 countries so far that adopted the PM standards in line with the 2005 air quality guidelines. And the global air quality divide shown before is just continuing. So, Maria, what will WHO do to make a real change in air quality in line with the science-based air quality guidelines? Please, Maria, open your microphone.
Thank you very much, Nino. I hope you can all hear me. Is that okay? Let me start, Nino, by saying that you were telling us how lucky you were in your career. Let me tell you something. We are the lucky ones, Nino. We are the lucky ones for having you in our life, for having you contributing to WHO for so many years. Without you and your team and your colleagues and the ones that you have been presenting today, we will not be able to have the strong science that we have behind us, and the one that allow us to be very strong in terms of scientific and policy recommendations. Nino, I ask myself this question every morning. Why are we not reacting to this huge problem with the magnitude and the proportion that these magnitudes of the problem will require? And let me share with you some thoughts. It is because we don't have enough science. It is because the science is not clear enough. The answer is no. We have a very strong science, as you rightly say. We have more than 60,000 papers dedicated to prove, to demonstrate the linkage between air pollution and how our health is suffering. So it's not lack of scientific evidence. Second, there are no excuses. The governments cannot find an excuse to say that they are not applying the air quality standards because they don't have enough interventions, they don't have enough tools, they don't have all the science behind that to demonstrate that one intervention is useful. Is that because the health community is not properly involved and informed about this? Maybe. We need to mobilize a little bit more our own troops, our health community, for them not only to treat asthma cases when they live in a city where the asthma cases will be very high, or treating all of those chronic respiratory diseases because they are caused by air pollution. Instead of treating those diseases, they should treat and advocate and influence and be very strong on their voices, raising their voices with their politicians, with their governments to do something about that. Today is a very important day because we have published, I hope you saw it on the media, the WHO and a very large group of health professionals, we are calling for a treaty of non-proliferation of fossil fuels. As you rightly say, this is still very complex how we need to deal with air pollution, but one of the most important causes of air pollution is the combustion of fossil fuels. And we know that if we stop this nonsense of combustion of fossil fuels that is literally harming our health in an incredible way, contributing to the causes of climate change, and then destroying as well the economy of a country and costing a fortune to the health system, we can put it in positive. We can give the right arguments for people to understand the health argument behind climate change and air pollution. If you tackle the causes of climate change, the most important benefits that you will obtain immediately will be the reduction of air pollution and therefore the reduction of the mortality and morbidity associated with that. What are we missing? I don't know. I mean, there is a political willingness to do that. I think the sample of Switzerland is very good. You have scientific evidence. You took the health argument to move and to prioritize your intervention. You put your intervention in place. You are still a very rich country and a healthy country and wealthy country, and you have protected the health of your people. So we need you as a model as well to start to mobilize more attention, raise more attention. What are we doing? We are taking the air pollution issue to the COPs, all the climate change negotiations, because we want them to realize that there is a win-win if we go for that. We are quantifying the health benefits that can be obtained if we tackle the causes of air pollution. We are bringing as well the economic benefits that can be obtained. We are pushing for this revolution transition to clean, renewable sources of energy, and we are creating a big network of health scientists, health professionals, politicians, activists, mayors of the big cities, because they can be as well very important partners on this. And hopefully with all of this movement, for sure WHO is extremely committed to raise awareness and put it very high on the political agenda, this issue of air pollution, which is killing 7 million. And we could avoid 7 million if we take the right measures. So again, Nino, thank you very much. We need you dramatically for implementing our air quality guidelines. I hope any politician around the world will have on their desk a copy of the air quality guidelines together with the mayors of all cities around the world. And the citizens will put a lot of political pressure on them to start to apply those recommendations. Thank you.
Maria, thank you so much. I don't know whether you hear the applause here. It's wonderful to still see you have all this full energy it needs to continue, not give up. You know, scientists are behind you and you are very talented actually to bring the science on the table. That's wonderful. Actually, you linked back to Switzerland, mentioning we are a wealthy country, and of course that is true. And I would like to move, in fact, to another Swiss issue, which is not the Swiss Federal Office of the Environment, but now actually the Swiss Agency for Development Cooperation, because they have a global perspective, and maybe there is some help for WHO from a Swiss perspective. So please, I am very pleased that Janine Kuriger agreed to join this session online. That's fantastic, Janine. You are the head of the section Climate Disaster Risk Reduction Environment of SDC. And the SDC ambassadors, they reach out to the world to, in fact, bring Swissness to other countries. And as mentioned, Switzerland has an excellent record in clean air policy making. And instead, in many countries of the world, also SDC focus countries, pollution remains terribly high and it's getting worse. And I really wanted to know from you, Janine, what is the strategy of SDC to let those countries also embark on sustainable solutions to keep the air healthy? Please, Janine, thank you for being here.
Thank you, Nino, for the invitation to participate in this very interesting panel this afternoon. So maybe before I enter into the strategies, I would like to say a few words on why SDC as a development agency is working actually on air pollution. And I think we've already heard it before, but it seems to me important to re-emphasize it, that reducing air quality or air pollution, excuse me, is actually crucial for meeting the sustainable development goals. In fact, there are a lot of multiple development benefits that we can gain from reducing air pollution, and I would just like to cite a few. Obviously, first of all, it's the human health, and we have heard it today. There are over 7 million premature deaths, which are due to air pollution. Also, just last week, the WHO also stated that 99% of the population worldwide are actually exposed to air pollution. And if we do work on the causes, reducing the causes of air pollution, we can actually improve substantially the living condition of a lot of people around this world, and also to make them more resilient to a variety of diseases that are related to air pollution. The second benefit I would like to mention is on food security and protecting the ecosystems. Here also we do know that actually air pollution has a negative impact on crop yields, and therefore also on food security, and it is also nefast to ecosystems. The third benefit I would like to mention is climate change mitigation. I think here again, and it has been just mentioned also before, reducing, decarbonizing the energy, the transport and the industry, reducing emissions from these sectors has not only a positive impact on the air quality, but it also has is very much important if you want to make a move on climate change mitigation. I think for all these reasons, it's obviously, I think, at the heart, if you want, of a development agency to also look into air pollution issues. The second point I want to mention is, while air pollution is a threat to all countries, I think you have shown it before, Nino, as well, we do see that it hits least and middle income countries the most, and within this country, in particular, the vulnerable group, such as women, and also the poorest of the society. Another reason why we as a development agency are very much engaged in it. SDC has been actually working on the topic almost as long as Switzerland has been already also engaging in air pollution policies. We have also a track record for over 30 years working in different partner countries, also on different issues related to air pollution. Our aim actually is to contribute to systemic change that allow to improve the air quality. And we do this mainly by using a three-pronged approach. First of all, I think, as it has also been stated before, we do invest a lot in creating evidence, basically also scientific evidence, in order to really raise the awareness about the sources of air pollution. So we do, in order to do so, we work together with academia from Switzerland, but also from our partner countries, in order to establish the scientific evidence base. We use then this information in order to inform policymakers, but also the population in general, about the sources of air pollution, the impacts that it has, and how it can be tackled. For giving you an example, right now, actually, we have a collaboration with China, and there we do have a joint scientific research going on between the Paul Scherrer Institute, the ETHZ, EMPA, and the Chinese Academy of Science to develop actually new methodologies to more precisely identify the sources of air pollution in China using real-time source assignment. And this is actually foreseen as a basis to develop more targeted and effective air quality policies. Then the second approach we take is to really develop and implement innovative projects on clean technologies, which reduce short-lived climate pollutants. There also, we have really seen that in order to convince policymakers about the importance of investing in air pollution reduction, it is important that you can also showcase some real good examples of what is working and what is not working. And a lot has to do also with transferring know-how on doing things, but also transferring know-how on technologies. And then an example I would like to cite here is that in Latin America, we work with different municipalities, the ones of Bogota, Lima, Mexico City, and Santiago, in moving towards thought-free low-carbon bus fleets by either using and introducing Euro 6 standard buses, or even better, moving into electric buses. And on the other hand, also what we have seen as one type of machinery that is actually neglected and never looked at is actually the non-road construction machinery, all running on diesel and not using any filters at all. And there also we have been able to create awareness about the pollution that results from this machinery, and also supported the corresponding filter technologies in order to improve the air quality. Third strategy that we use is to work on the framework conditions, and we do support our partner government in the development and implementation of clean air policies and plans. We do that by using, on the one hand, the evidence-based information that we have from our scientific collaboration, but also the demonstration that we have from working and implementing concrete projects on the ground. In India, for instance, right now we do support India's government at the subnational level in implementing India's recent National Clean Action Plan that has been developed a few years ago and is now being implemented at the regional level. And the aim of our cooperation is to enhance the capacities of the city and state authorities to implement cleaner policies and action plans, and to raise also the awareness of cleaner action. Again, we do that based on information that we have about types of resources, and also in sharing and developing strategies to really reduce those pollutants. So it's really an a combination, I would say, at the end of the day, between these three approaches, which help us to contribute to a systemic change, to make a difference with regard to the way governments approach air pollution, and how they also do develop and implement policies. Last point I would like to mention is that for us as a development agency, we do not only work at national level, but we also are part of more global platforms and initiatives where we do bring together and feed in our experiences from the ground. And one of these initiatives is the Climate and Clean Air Coalition, which brings together over 140 states and non-state partners and over 400 other stakeholders. The objective of this initiative is actually to stabilize the climate warming below 1.5 degrees and also drastically reduce air pollution with a specific focus on short-lived climate pollutants. There, actually, we do much emphasize on experiences that we have made in our partner countries, but also experiences from Switzerland itself. And we are also very happy to count on Nino's participation in the scientific advisory panel of these initiatives, so that we can really bring forwards, on the one hand, the science that is related to short-lived climate pollution, but then also public global commitments by leaders from around the world in order to move the agenda forward. So Nino, thanks again for having invited me to participate, and I hope all the best to you. We haven't had the chance to meet now, and unfortunately I was not able to attend in person, but I'm sure we can still count on you also at the international level. So thanks a lot.
Thank you, Janine. Thank you. Well, it gives us some hope to hear what SDC and WHO are doing and their link with science. But I think we would all agree there is still some room left to do and act together, and actually even to come back to science, which research, which is my last step in this afternoon. I would actually, as a next, come back to asking Temitope Adebayo to come on stage. Temi, you studied in Nigeria and then in Pretoria, and you were induced to do a PhD on the acute effects of ambient air pollution in Cape Town. And thanks to prestigious fellowships, you were able to come to Swiss TPH, and you will soon defend your thesis. But I'm not asking you anything about the thesis. Those interested in her thesis, you can go to the FAME Lab in Bern. She got selected as a finalist to be the Basel University representative with an elevator pitch on her thesis. I looked instead on your motivation statements that you made when you applied for the PhD. Yes, you were motivated. I'm reading what you wrote: to achieve excellence and satisfaction through hard work, a firm sense of responsibility and commitment, while adding value to a progress-driven organization. Sounds good. I wonder, Given the enormous inequities, Temi, that we just highlighted in the world when it comes to air pollution, the lack of progress, the lack of shared policies, inequities in pollution science, etc. What do you think the priorities should be in order to make a change, to make clean air also a reality in the megacities of the African continent? Please come on stage.
Thank you very much, Nino. And first, I would like to say, I hope I have been deserving of being your final student. It has been a great pleasure to have you as my supervisor, and I have grown quite a lot. So, and also congratulations on a very, very great career, a successful one that is also very impactful. I know you're cringing right now, but really you have done the work and we can only hope to follow in your footsteps. So talking about the priorities that we need to focus on in Africa, particularly our mega cities, I would like to imagine that the African leaders are actually seated amongst us. So in this moment, I will be speaking directly to them with my imagination. First, I think we need to prioritize, like Nino already alluded to it, cleaner fuels, because that is what we rely on very much in the African society, particularly for the growth of our economy, urbanization, and also industrialization. There is a need to reduce the sulfur content in our fuel. This is not impossible because we already did that in our diesel, rather. We already did that with unleaded, the unleaded fuel, because that was removed. It took us 99 years, but we finally did it, with Algeria being the last one in 2020 and Sub-Saharan Africa doing it in 2006. So there is progress, there is evidence that this is doable, it's not impossible. So it is also possible for us to reduce the sulfur content in our diesel, because we rely on that very heavily. And also there is a need for us to have cleaner vehicle technologies. We are in 2022, we should be moving towards cleaner cities, sustainable environment that is the transport system, one that takes people to their place of work and place of business, speedy and also in a safe way, but is not impacting on their health. And secondly, there's no way we can talk about cleaning our energy, cleaning our air without talking about household air pollution. Household air pollution is a very important aspect of pollution in the African continent. People are still using open fire for their cooking and for their heating. And most of the people who are suffering from this are mothers and children, women and children. And it is important that the African government take a stand, put in the action to make sure that there is proper service delivery. Because if there is electricity, if there's gas, if there's cleaner fuel, people will not be using open heating, open fire burning for their food and for eating of their homes. And thirdly, we need data and policy. There is no way we can do research without data. We need data to do research. We need research to produce data. It is in that particular order. And so there is a need for air quality monitoring in our African societies, because only South Africa at the moment has the most robust African air quality monitoring system. And this cannot be said for the other 53 countries in the continent. So there is a need for us to monitor our air quality, even the need for emission inventory, so that we can know what sources we have to target, what sources we have to push our intervention towards, and target those. And that way we can eventually start to reduce air pollution in our society. And talking about policy, science and data drives policy. If there is no investment into science, into our academic society, into the different sectors, then we cannot have a policy that is very much based on science evidence. So there is need for investment, and there is a need to tap into the skills, the knowledge, the expertise that is already existing in the continent through the young people. Africa has the youngest population in the entire world. So there is a need to tap into that resources that is already available to us. And fourth, we need partnership, cross-country partnership, national partnership, cross-country partnership, because we cannot clean the air in one country and create a bubble over it. We need to engage with our neighboring countries and share these ideas and share these lessons that we're hearing, the unique opportunities that may be available to us. We need to share, and that partnership and collaboration is important. And lastly, action. Action and action and more action. We can talk and talk and talk, but if we do not put things into place, then we're just delaying the inevitable. Inaction is costing us lives in the millions. A day is 1,000 or 100,000. Another year is 4 million, 5 million. Number of lives lost cannot be an acceptable number, cannot be acceptable for advanced in economy and growing of a population. We need to take action every day, and this requires a multi-sectoral approach. This requires every hands on board. And yes, thank you. That is it for me.
Well, Temi, you are my very last PhD student, as mentioned. I will supervise you until the defense, which should happen this year. Yesterday, we talked about the needs to link science with policy. Maybe Temi has a great future to bring the science into politics. Yeah, that would be great. I just want to list my PhD students just with a very big thank you. Throughout my time as a scientist, I have to say, I really learned so much from working with this next generation of scientists and people who defend science also in the non-scientific, non-academic world. So last but not least, Nicole, I promised to ask you the very last question, but well, it's a symbolic day today, and this needs some comments before. We, you and me, are the only air pollution epidemiologists in Switzerland who started to work in this field together already in 1990, and who belong to this research community still today. Our collaboration survived many, many tough situations, retirements, actually, all your years in the California, in the US, in Los Angeles, in Zurich. My 10 years abroad, I studied and I worked and lived with my family in Berkeley, in Los Angeles, in Barcelona. It survived it all, and it's still there. And this is wonderful. I really enjoy that. And talking about Los Angeles, I have to really tell you story number 9, my luck number 9. It was your network, your experience as an assistant professor of the Keck School of Medicine, University of Southern California, that opened indeed the Keck School tenure position that I was then brought to USC. And that, I think it would not have happened without knowing you and without you knowing the team there. So I had this real big privilege to work with this incredible powerhouse with more than 100 professors in public health. And not many had this incredible opportunity to work with the unique and scientifically outstanding team of the USC Children Health Study. The years at USC were a real highlight for me. And the Children's Health Study remains the most important research about the effects of air pollution on the development of adolescents' lungs. So, Nicole, great thanks to that. But in 2004, we suffered all my friends in USC suffered because George W. Bush got re-elected in that night. Actually, I took action myself. And it is, again, my luck. My friends at USC didn't have the luck. I reached out to the European colleagues, and that's my 10th and last career luck. I had the great honor and pleasure to be the first epidemiologist to get an ICREA professor position in Barcelona, which offered me the opportunity to work in this time, in these midwifery years of the Center of Environmental Epidemiology, CREAL, in Barcelona. Now it is IS Global. It's really created by these outstanding scientists and friends. And I have to tell you, as spectacular as the people and their research is, there was the location and the building I had to honor to work. Can you imagine this red dot? That was my office with the view to the Mediterranean Sea, to the beach.